I think it's very clear that during the pandemic, there was a need for closing for elective surgeries. Our institution, same as other medical institutions, and that was the safest things for patients to close because of the pandemic. However, knowing that transplantation is a life-saving procedure, we decided to keep it open and try to bring the highest care that we can bring to these patients. This has been done with the support from the institution for protecting our patients and continue providing life-saving procedures for them. The need of a liver transplant or sometimes of a kidney transplant, it's higher than the risk of COVID. We have been fortunately to have very good outcomes with all the multiple transplants that we have been doing with the care that we have been providing.
The patients that are on waiting lists for organ donations don't have the luxury of time. And so it's very important for transplant programs, whether they're cardiac or liver or kidney, to be sure that we are taking these risks that the patients have on the list, balanced with the COVID time. And so we've been able to continue the transplant program for hearts for that need. The patients that have had heart transplants were very sick. And so regardless of COVID or not, their expected survival would be very poor without a transplant. So you're at a point where you have to do the safest operation possible, take all the precautions for COVID, but then still take care of the patient's needs.
With all the good care that Strong provided me, and with the rehab, I was able to walk out of the hospital and start celebrating life. I've always liked outdoor activities. So playing golf and riding a bicycle, going for walks. I used to travel a lot with my family. Hopefully I can resume all those things again.
The hospital is probably one of the safest places to be in the COVID era because everybody is screened, including all the members of the University of Rochester medical system and all the patients.
I would say it's safe to come as a patient. You don't have to wait for coming to the University of Rochester. I personally feel more comfortable and more safe to be in the hospital than being out there going for shopping or trying to go and buy a coffee in a shop.